Where is your question? Right. So if you have read and understood,
Yes, ma'am.
considering its surgical pathology station, kindly tell me what are the differential diagnoses that you will consider for her?
In this patient, the differential diagnosis will be giant cell arteritis, transient ischemic attack, stroke, vasculitis, thromboembolism.
Good. How would you confirm your diagnosis? What tests
I will
would you ask for?
temporal artery biopsy.
And is is the temporal artery biopsy conclusive test performed?
No, it's 50% conclusive, but to rule out the other condition, I have to go for biopsy.
Can you define the term giant cell arteritis? What
That
is
is
the
the
mechanism?
inflammation,
Sorry.
inflammatory disease of the blood vessel. This
Okay.
is called giant cell
So what is
arteritis.
the mechanism that is involved? What is the pathogenesis which is involved in it?
The involved arterial segment develop the intimal thickening and that reduce the luminal diameter, ultimately reduce the blood flow. There is granulomatous inflammation in the internal elastic lamina, infiltration of T cell, interleukin and macrophage, which um, mm, invade the inflammation, and interleukin
What happens?
secret.
Okay. There are three layers of the vessel
Yes,
from
and
inside to
usually affect
outside.
the
Yes, this
tunica medium.
intima, between intima and
Intima,
media.
intima medium.
Yes. Okay. Can you tell me which part of the vessel is most likely affected? Or what type of vessels are mostly affected?
Mostly and large and medium,
Okay, very
mainly
good.
in the head.
Okay. Right. Can you tell me what is all right? You already told me. What is if you have done the test? You told me only one, and that was not conclusive. There are other tests as well. Okay. Once you have made your confirmed your diagnosis, what is the treatment or management alternative that can be offered to the patient?
I will treat the patient. If it is a giant cell arteritis, I will give the steroid and start prednisolone 60 milligram per orally, or I can give the IV methylprednisolone if there is visual loss present or any previous history of MRCS fugas.
Patient,
Usually it will
yes,
2 years course.
2 years course. Okay. Patient is an elderly lady. And what are the precautions that you have to keep in your mind while writing or
Writing the
prescribing?
steroid.
Yes,
Okay, as
corticosteroids.
steroid can causes the osteoporosis and avascular necrosis, which can lead to fracture.
And
And
can you describe the mechanism by which these corticosteroids they cause osteoporosis?
yes, it causes the direct inhibition of osteoblast formation
Mhm.
and direct stimulation of bone resorption, inhibition of GIT calcium absorption,
Yes,
inhibition of sex steroid,
yes,
and stimulation of
renal.
renal calcium loss.
Very good. This loss of calcium can also lead to pathological fractures. Can you,
Fracture.
yes, can you name some other causes which lead to pathological fractures?
There is some non-neoplastic cause and neoplastic.
Very good,
Neoplastic usually skeletal metastasis, and non-neoplastics are recurrence, osteomalacia, osteogenesis imperfecta, and neoplastics others are Paget's and multiple myeloma.
very good. Can you tell me how would you take care of this complication of the patient? How, in other words, how would you manage osteoporosis? First, how would
Uh,
you confirm that patient is going through or suffering from osteoporosis?
I will do some blood investigation, and if
And
a bone density scan,
okay, bone mass index of,
bone mass index.
yes, yes. And which blood tests would you do?
Yes, sir.
Which blood tests would you do?
Serum calcium.
Yes, and
Yes, sir.
okay, very good. Can you, okay, once you've established that patient is suffering from osteoporosis, how would you take care of that? How would
I
you
will
manage? Yes,
give some supplements of vitamins. I will lifestyle modification and avoidance of smoking. If she takes any kind of other drug like heparin or he takes alcohol, we have to avoid that, and vitamin supplements also be given.
okay, considering the patient is 87 years old and suffers, if she's suffering from giant cell arthritis, patients often present with visual disturbance. Can you explain why?
Ophthalmic, due to ophthalmic artery involvement.
Involvement of, okay, very good. There is another major risk factor with which can be involved because of the use of steroids, of corticosteroids, that is pathological fractures. So how, if a patient presents with a sudden shortness of breath, what would you suspect?
There might be a case of fat embolism
Okay, what are the causes
or
that,
pulmonary embolism.
yes,
In
how would you
in
manage that patient?
specifically, this patient might be a pathological fracture which may leads to fat embolism or pulmonary embolism. I will manage this patient as CRISP protocol. Look
Okay,
for airway, breathing, and circulation, and then manage the patient accordingly.
all right. Right, you told me this. Okay. All right. You'll tell the patient about the, right. Okay, who would you involve in the management of a patient who suffers from giant cell arthritis?
I will manage the multidisciplinary team, the vascular surgeon, general surgeon, medicine specialist, orthopedician surgeon, and social worker,
Ophthalmologist and endocrinologist.
ophthalmologist, and endocrinologist.
Okay, right. What, right. If a patient who's taking this patient, you have written corticosteroid, then patient has pathological fracture, and because of that, you need to operate on the patient. What would you keep in your mind?
This patient may develop Addisonian's
Very
crisis.
good, very good, very good, excellent. So in order to take
I
care,
have to give IV steroid.
yes,
I we have to take pre-anesthetic checkup, uh, take special care during the induction of anesthesia and during the whole procedure. And after the surgery, we have to take special care for the infection and wound healing also.
okay, very good. Everything was very good. You told me elevated ESR later on. but LFTs will also be alkaline
LFT
ALTs,
and platelet
ESRs,
count,
CRP, platelets, and
CRP,
even if you
platelet
will do the
also.
ultrasound of the
There is
temporal
hello
area,
sign.
yes. So all these tests you should
I
have
have
told me,
just said. Okay.
which you didn't tell me in the beginning. All right. And if patient is suffering from osteoporosis, then okay, you did tell me that you will do the bone scan and that stuff scan. All right, good. Okay, satisfied. Thank you.